Objective 1 is to use a computerized physician order entry system. So let me first tell you guys that this one, when the first ruling came out, it was really strict. They've loosened it up quite a bit. So this one, really all the measurement is requiring is use of CPOE for medication orders directly entered by any licensed healthcare professional who can enter orders to the medical records per state, local, and professional guidelines. So basically what it's saying is with order entry, what we've done is we've connected order entry to actual prescription templates. So the example that I've been telling everybody is patient comes in and they need a Rocephin injection, or the patient comes in and they need a morphine injection, something that you would do internally, but it's medication related. What you can do is you can order it through order entry now, and that will go to both places. It'll be an order, and it'll also go onto the medication list. And what that'll do is if that's only on there for a duration of 1 day, it'll automatically go off that medication list, automatically off the current medication list after that 1 day. So that's the measurement. That's a little bit of an idea about what that was. The note's telling about how it was simplified. So here's the big question that came up last week, and I told you I wasn't going to lie to you. This is the question that came up. So last week people said, well, I don't do that kind of stuff. I don't do injections in-house. I only do prescribed medications. If you put just medications on the current medication list, that's going to fulfill this as well. But if you ever do those injections or anything like that, that's where you're going to need to make that for a CPOE. If you don't do those things in-house, it'll work just as well if you're just putting those on the medication list. So that's the measure. Here's what they're actually looking for. So this is the actual statistics that they want pulled out of your system. So they're looking for more than 30% of your patients with at least one medication in their medication list that are seen to have at least one medication ordered using a CPOE. So if that makes sense to you to order it through the order entry, then you're gonna be able to use that. If you don't do any drugs like that, then it's just gonna be fine coming off of your medication list. And right here, both electronic prescriptions and medication orders entered through order entry will count. And then this is made possible through 9.5, the linking of the order name maintenance to RX template. So if you guys, I don't know how big of geeks you guys are in Practice Partner like I am, but the order name screen, there's an actual spot now where you can actually pull in the medication template, and you can connect those two. So you can connect an order to a medication template now. 9.5 only. 9.5. This is where we're going to talk about the denominator and the numerator of this. So basically what the denominator is going to be all of your patients who have at least one medication that is not marked as outside. And a qualifying medication could be active or historical. The numerator is going to be where at least one medication where the operator is doing it. So the operator equals the provider. And on no meds will not count in the numerator. So you can't just have an order that says on no meds and then it orders it. That's cheating. Shame on you for thinking that. I knew you guys were.